Known as the Hub of the North, Thompson, Manitoba lies 740 kilometers north of Winnipeg. Serving a regional population of approximately 45,000 in the northern health region of Manitoba, the Burntwood Community Health Resource Centre opened in 2000. It was immediately plagued by an overwhelming number of complaints from the community due to extremely long waits for appointments.
Shortly after the clinic opened, there were significant challenges in terms of access for appointments. Patients were waiting 3 to 4 months for appointments.
When the receptionist would take the call, patients would be requesting an appointment. They would give them a date 2 to 3 months later. They would be unhappy, so the receptionist would put them through to my voicemail. I had calls coming out of my ears.
We would have lineups of people waiting to come in and see the doctor today. People upset because they're sick today and they want to be seen today.
I remember when it first started, if you came in, sometimes you'd sit there all day and you wouldn't even get to see a doctor. The waiting room was overwhelmed.
Advanced access really is focused looking at the patient. And so, part of the advanced access piece is we track data and we look at it from the patient perspective.
It's a continuous quality improvement initiative. The founder of Advanced Access, Dr. Mark Murray from the States, really talks about doing today's work today, this week's work this week. It's really looking at the opposite, saying, let's pull work in today, so tomorrow's a whole new day, a blank day, and then I can do tomorrow's work tomorrow. It's better to do everything you can at that visit, free up that time, and of course the improved patient outcomes and satisfaction.
Part of advanced access is being able to balance supply and demand. And you need to understand it in order to be able to balance it. So we started looking at what is our demand for appointments, what is our supply, and then at the end of the day, who came? So how many people actually came for their appointments? How many did we add in? And how many no-showed? And then that no-show piece is looking at why are people no-showing and really implementing strategies to help to decrease the number of no-shows.
Advanced access is handling today's demand today, respecting patients' time, matching patients with their provider, balancing patient demand, provider supply, improving office efficiency, workflow, optimizing the care team to provide the best care.
When I'm not here, my nurses review my lab test results. They see my patients. I had one patient with a leg ulcer that they thought looked infected. They took a digital photo, sent it to me. I prescribed the antibiotics. So even from a distance, 800 kilometers away, I can still manage my patients using my team. And I think that's huge.
I'm saving a lot of time, and I'm getting a lot better results too, because now we get the nurse's input, my input, and the doctor's input all in one. It's amazing. A little bit of communication, a little bit of cooperation, boy, it goes a long, long ways.
Because the clinic had at that point in time 8 years of lots of challenges for access, people were hesitant to make changes. People were hesitant to get us back into a position where we had really long waits for appointments. And so it was easier to get buy-in from staff to be able to say, let's just trial one physician for 1 week. And as we had success with that, we said, okay, well, let's trial this with more.
The biggest challenge for us was getting people to buy into the fact that their provider would be here or that we could book them to their family provider rather than they just taking an appointment with anybody.
If somebody's calling and looking for an appointment, the phone call to answer and to book that appointment is a lot faster if we can say, can you come in today? Versus, sorry, we don't have anything available and we're looking for an extended period of time. For the provider end, what they benefit is that they don't have to spend that first little while apologizing for the long waits to get in to see them. And patients are happy. Really, everybody benefits by having a system that runs that way.
We all saw that it could get better, and where we were, there was no way it could get worse.
There's a lot of misconceptions when it comes to advanced access. Some people think it's a scheduling system. It's a whole lot more than that. It's really a comprehensive assessment looking at how do you do those two strategies, access improvement and office efficiency. And those two strategies together help to get you to a point of improved access. Those strategies can be put into place really anywhere. I'm sure that as we started our work, there would have been thoughts of, well, we're in the north and we're remote and our challenges are different. However, the challenges associated with healthcare, I think, are pretty uniform across the country.
Once you get to same-day access, it's a different world. It's, wow, I can actually do this work today. If that patient needs my care today, they come in today. And as a provider, and I mean, 99.9% of physicians and nurse practitioners want good care, want to be able to provide that access. If you can do that, I think that that's a huge piece. We need to continue what we're doing. I mean, I think we're doing a good job at understanding the numbers, but we can never stop. Once we were able to get that continuity, get the access going, the complaints dropped off, and it's a rare thing that we ever get now a complaint about access.